Good morning, everyone. Thank you for coming. There's some pretzels up here if anybody wants to have a snack. And I just want to introduce Diane Morrissey from VMSC Services. She's going to talk a little bit about 2026 services for the ambulance subscription. We just ask that questions, if you have questions, we're going to wait till the end. So, is that good? Okay.
Okay, good morning. Thank you all for coming. It's great to see a nice group. Sometimes when I do presentations, there's only a few residents, so I'm glad to see that all of you that have come out, and thank you so much for doing that. Before I get started with my presentation, does everyone have a packet from the table here that these did come out in the mail? But if you did not receive one, this is how you would subscribe. If anyone didn't receive one, you could raise your hand and Leah can get you one. Does everybody have one of these or had one of these? Yes? Okay, perfect. Okay, so a little bit of the history of VMSC. Our name is Volunteer Medical Service Corps, Emergency Medical Services. We're based out of, our main headquarters is based out of Lansdale, across from Lansdale Hospital. We were founded in 1933 by Dr. Frank Boston. He was a gentleman that felt the need. Well, actually, he started Elm Terrace Hospital first, and then he felt the need for services of a 911 service in the area, so then he formed VMSC of Lansdale, and we've been in existence ever since. So we're very proud of that, and we are growing by leaps and bounds all the time. We estimate that we're going to be handling about 14,000 calls this year. Now we service not just the Indian Valley region, but we service the North Penn region, which includes like Lansdale, Hatfield, Telmenson, Upper Gwynedd, things like North Wales. That includes Indian Valley, which is this area, Franconia, Satterton, Telford, Salford townships. We service a small area of Philadelphia near Burholme, and I know it's been a lot in the news recently with Crozer-Chester systems closing. We have a small area in that district as well. Just be rest assured that none of our crews are split, meaning that every area has designated crews. So Indian Valley has a section of crews, North Penn has a section of crews, Burholme has a section of crews. So we're not pooling all our resources to one station. Okay, so right now we have seven designated crews for the Indian Valley region that are on 24 hours a day, 7 ambulances. We have 8 associated with North Penn. So when we receive those calls, the crews are constantly moving. We don't really see the crews that often at our main headquarters because they're always moving. If just say there's a call here Saturday night, then one of our other 6 crews will move into this area closer so that they will be in the closer vicinity to Saturday night if there would be another call or anywhere close to here. We have a program that we can not determine, but the computer determines where the next call is going to occur. It's called, let me think. I just had it on the tip of my tongue and I lost it. Well, I'll come back to that. But it's a program that generates where the next call is going to occur, believe it or not. And it's about 95% accurate. And I don't really know how it does that, but with the AI, I guess it's just crazy that they tested it out several times and said that they brought ambulances into an area that states that the next call was going to occur, and there was one in that area. So, like I said, we have multiple crews on every day, 24 hours a day. Our crews consist of a paramedic and an EMT. So if the paramedic is needed in the back, then the EMT drives. If the paramedic is not needed, then the paramedic drives and the EMT is in the back. So that's a little bit about VMSC, a little bit about me. I've been with VMSC. I just celebrated in September of this year 39 years with VMSC. I was a provider up until 3 years ago when I moved into the office, into the billing office. So I help with the subscriptions, answer patient calls, things like that, questions. So I'm mainly in the office right now. I truly do miss being on the street, but like my body just can't do it anymore. So I truly do miss it, but I still hold my certification as a paramedic, so I am still certified. If something big would happen, I could go out there and still treat a patient. Okay, so in regard to the subscription, VMSC conducts an annual subscription every year. It helps in two ways. It helps the residents of the community by saving money if 911 services are needed. It helps VMSC as a fundraiser. Like we're not tax supported and things like that. So this is kind of like a annual fund drive kind of for us as well. But I'm going to explain to you how it can help save a lot of money in a 911 situation. So I'm going to put this mic down for just a second so I get the information out of the packet here. Hold on one second. Okay, so our packets look a little bit different this year. We had a new company print and mail out our subscription information this year. So they are going to look a little bit different than what they have in the past. We offer 3 different types of subscriptions. We offer an individual for $75 annually, a couple or any 2 people, that can be 2 sisters, 2 brothers, 2 friends, whatever it might be, for $89, and a family membership, this began about 2 years ago, for $125. Now, I'm going to just speak a little bit on the family membership. So the family membership, and I'll use me as an example, I could cover myself, my spouse, my parents, my spouse's parents, my children and their spouses, and my grandchildren, all for $125. Now, they don't have to all live at my home, and they can still be covered under my plan. The only thing about the subscription for the family is that they would have to be serviced by VMSC. So if you have family that live in the area, either Lansdale, Souderton, any of our coverage areas, Burholm, Chester, anywhere, and they're serviced by VMSC, they can be covered under the family plan for $125. So that's like unheard of as far as savings. So that's the cost of the subscription. How the subscription works is if the patient has a Medicare or a Medicare Advantage plan, we bill the insurance and we accept what the insurance pays. A lot of times there's copays and deductibles with Medicare or a Medicare Advantage plan. Sometimes $250, $300 often per trip that they require the subscriber to pay. They pay their portion, but you're responsible for either $250 or $300. That no longer is you're responsible to pay to us. That is written off to the membership, and you're free and clear of any bill. Okay? With traditional insurance, and traditional insurance is slightly different, but very comparable. Traditional insurance would be like, not Keystone 65 because that's an Advantage plan, but like an Aetna or something like that is a primary. Those are, if you have a copay or deductible, they have to be paid to us first, and then any remaining balance would not be the responsibility of the patient or the resident, and we write off any remaining balance of that one. So that's the only difference between Medicare or Medicare Advantage plan and a traditional insurance. Okay? All right. I know it's a lot of information, and we are going to try to hold questions to the end, but if you don't want to forget your questions, jot them down or whatever. So on the inside here, it talks about, again, pretty much what I just said about why you should subscribe, the trusted care that we provide 24/7. VMSC is one of 2% of organizations in the state of Pennsylvania that can now administer whole blood in the ambulance before you even get to the hospital. So if there's a trauma situation where you're either bleeding internally or bleeding externally from a wound, we can administer blood even before you get to the hospital. So that's quite an achievement for us because, like I said, we were only within 2% of the state that have been permitted to do that. We offer community care programs such as CPR classes and first aid classes. We have mobile integrated health where we go out and we, much like the visiting nurses and things like that, after someone's discharged from the hospital, we go out and do like assessments on patients, enabling them to remain in their homes. I know that wouldn't pertain to here because of the nursing facility. We have a stroke response. We don't have a stroke unit, but Lansdale Hospital is a stroke center, meaning that they have the medications readily available to treat a stroke so that they can get the clot busters and stuff in working to get that clot either removed or withdrawn so that you could get better response as far as recovery from a stroke. And then the back here is, again, this talks again about the whole blood, and on the very, very back is where it says household subscribers. So if you're subscribing for anyone other than yourself, this form should be filled out as well because it's going to ask for the patient's name, the date of birth, and the relationship to the primary subscriber. Okay? That's how we track our subscriptions in our system. We look up the patient's name, date of birth, and address, and if they all match, then our billing company will mark that trip as a subscriber. If something is not the same or different, then that would be a billable call. Obviously, we're all human, so if you are a subscriber and you would receive a bill, please call our office and speak to me or any of the girls in the office before you pay that remaining balance, and we'll double check our system to make sure you are indeed a current subscriber, and we will contact the billing company and advise them. It's just easier to check with us before you pay it because the refund process, you would obviously be refunded, but that takes a little bit of time. So we would rather you call us first than pay it and then have to wait for a refund. Okay, so that's that. This resident medical history card, this is a yellow card. This comes in that packet as well. I bring these to all the presentations, and this is new this year, that they're in the subscription packets. We never offered these in the packets before, but these are very helpful to EMS. The reason they're helpful is for the members of our community that live in their own homes and things like that, we ask the people that they post these on the refrigerator in their homes, not to send them back to us, and fill them out. If there's something on here that you're a little bit unsure about or feel uncomfortable adding, you just don't add it. It's not a big deal. But these are helpful if you would be found unconscious or unable to speak, like due to a stroke in your apartment or your home. EMS looks for these on your refrigerator, and they will use this card, like for your care, to see what meds you take, what medical history you have, things like that. We call these cards our like little golden ticket because they're very, very helpful. I don't bring these cards, or we don't include these cards to make a change to the system that you might already have in place here. So I'm not saying that you have to fill this card out. I know a lot of the nursing facilities have like a folder or something that you put like a face sheet in that has all your history, your meds, your insurance, all that stuff listed. So if you don't want to fill this out, it's fine, especially in a facility like this. But we always just bring them along and put them in our packets because these go out to thousands of people. So that's why these are in there. And then this envelope, this would be to subscribe. So again, you would fill this top portion out. If you're using a credit card, there is a slight processing fee for a credit card. And then you just seal it and mail it back to us. The envelope's on the other side. It will have a Fort Washington mailing address. We have a new lockbox this year because we were getting flats, large flats of envelopes, and we were finding that, not that we're getting mixed up or lost, but we were trying to avoid that because the company opens the mail, scans every document that's sent, and sends it to us as an Excel file. So we get everything that is sent to us. But don't be concerned that this is going to Fort Washington because it truly is our lockbox. Okay? All right. And then a couple of other things I want to, the other thing I wanted to mention was going online to subscribe. You're able to go online to subscribe. The only problem with going online to subscribe is that the Indian Valley Drive begins on January 1st of every year and runs a calendar year until 12/31 of 26. So anyone can join anytime throughout the year. You can join, today, it'll start January 1st. If you join in March, it will be backdated to January 1st. Okay? So for an example, if you would just say on January 3rd, okay, you didn't subscribe yet because you just didn't get a chance to send it or you misplaced it or whatever it might be. January 3rd, you had a fall and you went to the hospital, okay? On January 3rd, you fell, the ambulance was called, we transported you, you're at the hospital. You were fine, they sent you back. And on January 5th, because you're feeling better, it's like, oh my gosh, I forgot to subscribe to the ambulance. Like, what's gonna happen? You can call me on January 5th and subscribe, and you'll be backdated to January 1st. Okay? That's unheard of, really. A lot of people, a lot of organizations don't offer that. So you could technically, again, the call could be in November of 2026. And you join, and it's going to be backdated to January 1st. Okay? But if you go online to subscribe, it's going to give you the date that you subscribe until a year later. So we make those adjustments for anyone that goes online, and we adjust all those dates back to January 1st for the Indian Valley region. So if you do get a receipt showing that if you did go online, it's going to give you from whatever date that you subscribed until a year later. That is incorrect, okay? Because the terms for the Indian Valley region are January 1st for a full calendar year, okay? Okay. All right. So we talked about the subscriptions. Hospitals we transport to. This is always a biggie. Okay, VMSC transports to 5 different hospitals, okay? The hospitals that we transport to are Abington Lansdale, Grandview, Doylestown Hospital, Einstein Montgomery in East Norton, and Abington, Maine. They're the 5 hospitals we transport to. Many of those hospitals have specialties. Grandview is a cardiac and trauma center. Lansdale is a stroke center. Einstein is a cardiac and stroke center. Doylestown is a cardiac and stroke center. And Abington, Maine is a cardiac and trauma center. So if you would have a fall here and you mentioned to the crew that all my care is under Lansdale Hospital, okay, and you have a large laceration to your head, and you're bleeding, that crew is going to suggest to you, and it actually kind of advise you, because we have to contact our medical command physician at the local hospital, that because you fell and hit your head, you need to be evaluated at a trauma center. So Lansdale Hospital isn't a trauma center. So unfortunately, you're not going to be going to Lansdale Hospital. Okay, from here, you'll probably go to Grandview as a trauma. If you would need to be, if you don't want to remain there after the doctor evaluates you, they can arrange a transport, to get you to somewhere if you have to be admitted. But if that occurs, that's why we do that. Like, we're not trying to be defiant and not take you to where you want to go. If your condition is very unstable or very serious, like cardiac arrest or severe respiratory distress, we have to take you to the closest hospital by state law. We're certified. I have a certification. And if we go, if we don't follow those rules, they will pull our certification and we will lose it. The paramedics study for about 2.5 years to get their certification, and the EMTs are about just over a year. So we work very hard to obtain their certifications and keep them updated yearly. So that's, we don't want to lose them. So we're not doing it, again, to be, against the patient or anything like that. We're just trying to do what's best for the patient. All right, treat no transports. We have a, not a saying, but if we respond to a call, and I always use a diabetic for an example. So we respond out, someone found a family or staff or whoever it might be found one of you's in your apartment or your room unconscious. You're a known diabetic, you've been diabetic for many years. The crew will come in, do an assessment, check a blood sugar, and we'll just say that you were found with a low blood sugar. So the crew will start the IV right there in the room or the apartment and give you the medication needed to bring that sugar up to a normal range. The patient will wake up, in most cases, and look around and say, "Who are you and why are you in my apartment?" And we'll explain to them, take vital signs, make sure everything looks stable, and ask them if they would wish to go to the hospital. About 90% of the time, they say, "No, I don't need to go to the hospital. I've been diabetic for many years. I must have forgotten to eat," or whatever it was, "and I don't want to go to the hospital." So we contact medical command, because that's what we have to do when we get refusals, and we explain the situation. We give them vital signs, signs and symptoms, all that kind of things to the doctor. Sometimes the doctor wants to talk to the patient, but most times not. We explain the situation, and will tell the doctor that the patient does not want to go to the hospital. They have the ultimate say. The doctor has, our medical command physician has the ultimate say. But a lot of times he will allow them to refuse treatment as long as someone's there with the patient, a family member, staff, whatever it might be. If you are a subscriber, there's no bill to you, and there's no bill to your insurance. Insurance will only pay for a transported patient. So if you're not transported, the insurance will not pay, but you're not billed either. If you are a non-subscriber and not a subscriber to VMSC, and that occurs, and this could be anything from bandaging a wound to a blood sugar incident like I just explained, is $1,250 billed to you. Otherwise, it's no charge at all. So you can see just right in that example that this subscription, the $75, if that's what you're joining as, or even $89, pays for itself in astronomically. The average cost of a 911 call at right now is anywhere between $1,800 and $5,000. Depending on the nature of the emergency and how much care and mileage there is associated. So it can be very, very expensive. Who can join? Anyone can join. The subscription, skilled personal care, dementia units, any resident can join. The only ones that cannot are a Medicaid recipient. State funded, we're not permitted to balance bill a Medicaid. So those are the ones that we don't allow to subscribe because we can't balance bill you anyway. So it's kind of a flush because we're not going to balance bill you anyway because we can't by state law. And then the last thing I have is, like I said, we have 8 crews here in the Indian Valley region. Sometimes we're very, very busy depending on weather or whatever it might be. We average about 60 calls a day. So it's quite busy. And if all our trucks would be unavailable on other calls. We do have a reciprocal agreement with Harleysville and Skippack, and they would be the next 2 closest ambulances to this location. So if they would cover us, VMSC would cover us, or I'm sorry, if Harleysville or Skippack would cover us, your membership would stand just the same for them as it did for us. We accept theirs and they accept ours. Okay, so if you ever see an Harleysville ambulance here because maybe they're covering us, don't be concerned. If you're a subscriber, you're still good because they're going to, they agree to accept the terms just like we accept their terms. Okay. I think I covered mostly everything that I was going to cover. I'm going to open the floor now for some questions, and I can answer anything that you might have. Yes, the red. You can suggest, you can mention that to the crew. We don't, I mean, I think we've gone there a few times. We don't go there on an average, like on a normal basis, because we try to stay, I know Abington's further away from our coverage area too, but, it's on 663. Right. Yeah, I mean, I can double check. I know that there was some talk about St. Luke's, and especially with, right now, I know Grandview's maternity is being renovated, so all our maternities are going up to St. Luke's, so, because they're renovating Grandview Hospital's unit. So I can look into that for you if you want to stop up here after the presentation. I'll take down your name and phone number, and I can give you a call back. Any other questions? Yes. Yes. That's it. You can either mail it. Some of the residents have dropped off their subscriptions. I will take them back with me and we'll get them entered. It's totally up to you. Like I said, the address on the envelope goes to Fort Washington. That is our lockbox. They do come to us. They're just scanned into the system prior, like we don't physically see the check. They scan the check, they send it to our bank account to cash it, and we enter the information from the spreadsheet. So we like triple check everything to make sure we didn't miss one of the subscriptions, and we update anything that might have changed in a previous subscriber's data information, like maybe your apartment changed or your phone number changed, something like that. We make all those corrections. Any other questions? Yes. Now some, like Medicare will pay 80%, okay? That's what Medicare pays. If you have a secondary insurance, sometimes they will pay that remaining balance. The only thing that I would recommend that with that situation is call your insurance company, but lately, or we've been seeing more frequent that Medicare has been denying claims. And what that means is when our crews write a patient care report, like after they transport someone, they come back and write like a 5-page report about signs and symptoms, vital signs, what you were complaining about, how you're presented, things like that. And that gets sent to the insurance company. We've been having a lot of incidences lately that Medicare, representatives from Medicare receive these reports when they get the bill and says, oh, Mary Smith, she wasn't feeling well. And it said, like, Mary Smith was having general weakness. And Medicare, the representatives at Medicare, which I totally disagree with, says, I think Mary Smith could have taken an Uber, a taxi, called a family member, whatever. And she didn't need an ambulance. We're not going to pay it. And just that's all they said. They're not going to pay it. So then our billing company appeals it to Medicare twice. If it doesn't get paid after the second appeal, then it comes back to the patient that they have to appeal it a third time. Sometimes it's paid, sometimes it's not. If it gets to that point, if you're not a subscriber, you have that full bill. If you are a subscriber, then you would be responsible for 50%. I'm sorry, 60% of the bill, not 50%. They just changed that this year. 60% of the bill would be your responsibility to pay if you're not a subscriber. But that's only if Medicare denies it. And if our billing company can get it reversed, then we're right back into the same situation where you don't have any out-of-pocket expense at all. Does that explain your? Well, I would check with, like, you have traditional Medicare?
I have traditional Medicare and complete Aetna insurance that covers everything that Medicare covers.
Okay, so I would double check. Well, I can tell you that Medicare brings 80%. That's what they pay, 80% if they pay. And then you can double check with your secondary insurance to see if they would pick up that remaining. Now, if Medicare denies any claim, your secondary will deny it as well. Yeah. So, yeah, if Medicare doesn't pay anything, then no one's secondary will pay. Yeah, I mean, I guess the risk you take, you know. Sure. Any other questions?
What is the cost of subscription? Do you recommend everyone just have it, regardless of Medicare?
I suggest, I think it's great, you know, it's $75 for an individual to subscribe for a whole year from January 1st to December 31st. And it's like you can use the trips as many times as you want. Like, not that we want to see people have to go to the hospital multiple times, but it's unlimited. And if there would ever be an issue with insurance, you don't, there's nothing really, there's no worry to you.
Pay it once, not every year.
Annually, one time per year.
My wife and I, so it's 150.
Well, no, for you and your wife, it would be 89. Yeah, the couple fee is 89, the individual rate is 75, and a family rate is 125. Yeah, but that's annually, so every year it would be that amount to cover you for the whole year. Sure.
And my husband was on the floor, and the hospice said to call the ambulance. I did. I did, and when they just actually got him off the floor. He didn't go to the hospital. It was $1,300 and some dollars. I nearly dropped over. Had the home responded, I wouldn't have had the ambulance. It was basically somebody to get him up off the floor. So I just wanted to share, it's true. I tried to see if I could get out, and you just couldn't get out of paying that money.
Now, was BMSC the one that
I don't remember who, because this was in '22. And then '22, I got for myself, and I re-opt for it in '23. But I was in the hospital last year for 7 weeks and in health care. So I don't know, my son took care of my mail. I don't think he renewed it because it wasn't, no one knew if I would live, so I need to get it again this year. But I just wanted to share that it's true because it happened to me.
Yes, it truly is, and this isn't a sales pitch, but like, there's so many people that even call me after the fact. Like, you know, they might be receiving, you know, bills that they didn't pay from last year, from 2024. And they were like, well, what can you do? Can you help me? I'm like, I honestly feel bad. I'm like, we could have helped you. But it's now 2025 and I can't help you anymore because the call has to occur within the same subscription period. And I feel that BMSC is very lenient in just offering it to anyone. Like, it's almost like buying the car insurance after the accident, you know, in saying that if, you know, your call was on January 2nd and you hadn't subscribed yet, and now it's January 5th, and you can call me on the phone and say, Diane, I would like to subscribe, but I had a call on the 2nd. Is that okay? I'm like, absolutely, it's okay. It's going to be covered. Yes. Oh, that's okay.
Thanks. I don't have this situation, but I hope that you can clarify something. Someone that gets a family plan, say there are 6 members of the family that are listed, and one of them is a parent who's still living at home who's on Medicaid. Should their name be included on that list of 6, or do you eliminate that? You don't put that?
Not if that person's on Medicaid, no.
No, okay, so you would just put the 5 members, not the 6. Okay, thank you.
Any other questions that I can answer? Well, I brought some, for anyone that came in late, I brought fresh soft pretzels. They were warm when just before I got here. I picked them up on my way here to Saturday Mennonite. I thank you for all coming out to hear the presentation, and for all the supporters to VMSC that we've had in the past and looking forward to in the future. The phone number is listed in the packets and things like that. If you ever have questions, I'm there Monday through Friday from 8 to 5. You can request to talk to me if I don't answer the phone, because right now they're ringing off the hook because of all these subscriptions. But I'd be willing to answer any questions. If you have any questions that you didn't wish to raise your hand for, I can answer. I'm going to remain here for a little bit. But again, thank you for having me, and I always look forward. I used to work here at Saturday Mennonite long before I worked at VMSC for 10 years in the nursing section, so I love to hear as well. So thank you so much. Oh, one more question? I'm sorry. I mean, if you're not a current subscriber right now, and you had I mean, it's only a couple more weeks till the end of the year, and you want to be a subscriber, it's only going to cover you until the end of this year, and then you would have to join again. But that's an option that you have. Now, we're receiving mail now that is all being entered into next year's subscription. We're not entering anything Indian Valley into the current year unless someone calls us and says, oh, I had an incident last week, I would have joined for 2025. And then we enter it for 2025. But otherwise, everything currently is being entered for 2026. Because the package just went out for anything from January 1st of 26 through December 31st of 26. Yeah, you should have all received something. We had over 15,000 mailers that went out to the Indian Valley residents from our mailing company. Unfortunately, we don't have any control over the postal system after it leaves the bulk mailing location. So I'm going to leave a packet here with Leah of some additional packets if you need them, and then she'll give me a call if she runs out. You know, we can bring her more as well. Any other questions? Sure.
So just a reminder, it is through the calendar year. So for example, if you only sign up, say, I don't know, February 1st, it's only until December 31st, right? So it's not a whole year, it's only calendar year.
That's okay. Yeah, that's fine. Anything else I can answer? Okay. All right, well, come up and get some pretzels. There's plenty here. I have more in the box in the back here, so help yourself. And like I said, I can answer any other questions that anyone might have. Thank you. Yeah, I mean, we accept credit card or check. There is a processing fee for the use of a credit card. So the total, if you're choosing to use a credit card, for an individual would be $77.60. For a couple, it would be $92.02. And for a family, it's $129.09 if you're using a credit card. Otherwise, if it's a check, it's just a flat $75, $89, or $125. Okay? Sure. In regards to the cards, we are not doing cards this year. Membership cards, you do not need to present a card to the crew. If you do join, you're going to be entered into our spreadsheet. If you ever have any questions in regards to the subscription, you can always call, again, the business office and speak to me. We can look it up just to double check everything looks good. But there will not be cards sent out this year.